Hi, good afternoon. I'm Kalili Bien, and I will be the moderator for today's news conference. To start, Interim Austin Travis County Health Authority Dr. Mark Escott will first speak, followed by Acting Mayor Steve Adler, then Sarah Eckhardt, Special Assistant Judge Sam Biscoe, and for Spanish media, Dr. Guadalupe Zamora with the Central Health Board of Managers will speak. And then we'll open it up to a pool reporter who will ask questions from the media. Dr. Escott, over to you.
Thank you and good afternoon. I'm going to show some slides here that are related to an update that we have as it relates to our staging for COVID-19 and our risk in our community. We've been working, we introduced this 2 weeks ago, and we've been working to identify key measures to indicate the need to transition between stages, either a more restrictive stage or a less restrictive stage. And one of the things that we've been looking at and talking about for quite some time is the new admissions within the 5-county Austin MSA. This graph is showing you that the hospitalization rate since the beginning of our pandemic here in Austin. And it shows you that we've been oscillating between about 8 and 10 hospitalizations since the end of March. So what we've done is we've taken this information, we provided this data to Dr. Lauren Myers and her team at the University of Texas and asked them to look for cut points, good indications of when we need to dial back or dial up the activity that's happening in the community based on those measures, with the focus of limiting the risk of exceeding the hospital capacity within the 5-county MSA. Again, if we exceed the capacity, we're going to experience excess deaths. This means that we run out of hospital spaces, ventilators, ICU beds to care for people, not only for COVID-19, but for anything else. So what we've done is they've taken that data, and Dr. Myers and her team have indicated to us 5 different stages or 5 different cut points for transition to stages. The green stage, which is where we all want to be, would be 0 admissions on that 7-day moving average for hospitalizations. Stage 2 would be less than 5 admissions. Stage 3 is that 5 to 19. That's the stage that we're in now, that we've been in for some time. Stage 4 would be 20 to 70 new admissions on that 7-day moving average. And stage 5 would be greater than 70. So again, we've been talking about needing to stay at least in this yellow stage, the stage 3, with the hopes of getting into the blue stage where we can be a bit less restrictive in our guidance. But for now, we're gonna continue to be in stage 3, and we can all work together to transition out of this stage. We've been talking for quite some time about the need to continue the social distancing, to continue that personal hygiene, and to continue masking in public so that we can balance the public health and the economy in a way that can grow both. This staging will be part of a dashboard that we will be launching today. Now, this is a draft, this is a screenshot, but this is what it's going to look like. You can see in the middle, it's got that same graph that I just shared with you. On the left side, it's got the new hospital admissions, both the 7-day moving average and the number for that day. On the right side, the 7-day moving average of new confirmed cases and the number for that day. At the bottom on the left, you can see that it's got our doubling time, which is now sitting at 37.5 days and has continued to improve over time. Next to that, you're going to see a gauge with the hospital capacity, both the regular hospitalized beds, the ICU rooms, and the ventilators. And next to that is the 7-day moving average for each of those numbers. Again, we want to provide as much information as possible to the public so that you know where we are and you can adjust your behaviors and you can assess your risk for yourselves and your household as we move through this. And with that, I'll pass it over to Mayor Adler.
Dr. Escott, thank you for everything that you're doing for the city. And thank you for these new the charts. They're really easy to understand. Again, just to repeat what Dr. Escott said at a really high level, we all want to open up the economy. Everybody's done a really good job of staying at home and helping us to avoid the first surge of this virus. And we all want to get out and we all want to open up the economy as the governor is doing. We need to make sure that we do that in a way that does not have us overwhelming our hospitals. As Dr. Escott said, it's not only a question of having sufficient space for the people that have the virus, but if you have a heart attack or you're in an automobile accident, you go to the hospital, you want to be able to get the proper care. So those are the two things that we're balancing. As Dr. Escott has showed us with his charts, we have to stay below 20 daily admittances to the hospital. They look at it on a 7-day average. That's the number we have to stay below. Every day we should be taking a look at that chart, that graph that's going to be up on the website and say, are we getting closer to 20 or are we moving down below that? If we can get below that, we can get to the blue area, we can start opening up even more. If we start getting to 20, when we get to 20, what the doctors and the scientists tell us is if we get to 20, that we're on a path to overwhelm our hospitals and we're going to have to pull back, and nobody wants to do that. So I take a look at what happened in our community this weekend, and I'll tell you that I think most people, most businesses are approaching this cautiously. They're avoiding large groups. They're maintaining the social distancing of 6 feet. They're wearing face coverings when they're out in and among other people. Most people are doing that, but we saw some real examples this weekend where that wasn't happening. And I hope that that was just a weekend adjustment into this new world we're in, because we can't sustain that if that's something that's happening community-wide. I think that people in the community might be a little confused about whether or not whether or not this virus is over. It's not. It's just as infectious as it was 2 weeks ago. But the task in front of us is, if we want to reopen the economy, if we want to reopen life, if we want to increase physical interactions, then we have to do everything that's within our power and control to make that successful, which means maintaining 6-foot distancing, wearing the face coverings, making sure that you get tested when you have any sense of a symptom, staying home if you're not feeling well. We have control to some degree as to whether or not we stay in that yellow area in the middle, or if we go up to orange with greater restrictions or down to blue. We have it within our ability to impact that. We've talked before about we can't enforce our way to this. There aren't enough sheriff deputies or police officers. This has got to be something that collectively we want to do ourselves, and our individual actions then accumulate into community action. And finally, I would just say that this is not a political issue. The governor, lieutenant governor, encouraging people, recommending people stay 6 feet away and wear the face mask. Dr. Escott says that it's something that we need to do. It's something that's required in the orders here in Travis County and in the city, because everyone says it's the right thing to do. But at the end of the day, either we're going to get to increase hospital admittances, either we're going to go over 20 or we're not. That's not a political question. It's just what is real. If collectively we can avoid going over 20, then we're going to be able to participate in this reopening, and we have control over that. The numbers don't lie. The numbers are what they are. So more than anything else, for me, this press conference today is about making sure that the community understands we're trying to stay below that 20 number on a 7-day rolling average. Every day we should be looking at it. We should be watching. We should be tailoring our actions. Businesses should be tailoring their actions to make sure that we stay below that number. This is the color chart that is up for that's on the city website that Dr. Escott was talking about. Let's all watch his graphs every day. Let's stay below 20. Let's each of us do our part. It's up to us as to whether or not we want to make the reopening of the economy. And with that, I'm going to turn it over now to Judge Eckhardt to talk.
Hi, y'all. as we have said before, and as my wonderful partner, the mayor, has said so eloquently, the way forward is to adapt. We have a great partnership going with Travis County and the city of Austin, as well as with Central Health and Community Care, and also all of our surrounding counties that are part of the Austin Round Rock MSA that our public health department serves. So we're all going to move forward together by adapting to the continuing threat of COVID-19. As we've seen, anyone who has been watching our handy dandy one pager on the Austin and on the Travis County COVID-19 web pages, and I would encourage everyone, as the mayor has, make it part of your day that you check the weather and you also check where we are on COVID-19 threat. If you've been checking that, you'll see that over the last 24 hours, we passed the 3,000 mark in terms of the number of cases in the Austin Round Rock area. So COVID-19 is not done with us yet. But the best medical and scientific advice for staying safe in our homes, our communities, and at work is to keep practicing social distancing, face masking, personal hygiene, avoiding gatherings of 10 or more, and staying home when you're sick. These are simple adaptations at home, at work, and at play, and they have literally saved lives. So let's try and keep in that yellow zone and keep pushing it down until we get into the blue zone. Because if we go to the orange area where the threat is higher, we may need to adapt harder. We don't want to go back. We want to go forward into real world adaptations while COVID-19 is still a threat. So practice the love, y'all. Learn how to smile with your eyes over that super fashionable mask, and show the love by keeping the distance. And with that, I would kick it over to our tremendous partners in Central Health with Dr. Zamora, who is the immediate past chair of the Central Health Board. Dr. Zamora?
Thank you, Dr. Eckhardt, Judge Eckhardt. Thank you, Dr. Escott. Thank you, Mayor Adler. Gracias por estar con nosotros este día sobre el corona. Nuestra comunidad ha hecho un buen trabajo de aplanar la curva, pero debemos continuar nuestros esfuerzos para protegernos, proteger a Austin y proteger a Texas. Necesitamos proteger la salud pública y la economía. Si salemos, use su tapaboca o su máscara, porque con eso podemos proteger el pueblo. Como dijo el doctor Escott y el alcalde Adler, hay una publicación de la salud pública que puede uno ver todos los días, a ver cuántos casos hay. Ahorita estamos en la zona anaranjada. Y quiere decir que tenemos como 5 a 19 admisiones hospitales cada día en los últimos 7 días. Queremos mantener eso bajo o menos de eso. Por eso que eso indica que estamos mejorándonos. Si vamos a visitar a personas que están en riesgo de enfermedades como diabetes, alta presión, que se protejan, usen sus máscaras. Si uno se va a unir con una persona, que sean menos de 10 personas en la reunión. Queremos que sí es buena higiene, que lavarse las manos, no tocarse la nariz, la boca, y usar su tapaboca. Como siempre, estamos demostrando cualquier síntoma de enfermedad, quédense en su casa. Y si están una persona enferma, pueden visitar austintexas.gov y hagan un clic en la línea de auto-liberación. Las pruebas son gratis y confidenciales. La página de internet en la ciudad de Austin. Queremos rebajar los casos de corona. Gracias.
All right, thank you. Now we are sending it over to our pool reporter, Samuel King from KT. Go ahead, Samuel.
Hi, good afternoon, everyone, and thanks for doing this. The first question is from us at KT, is probably primarily for Dr. Escott. What is the nature of the hospitalizations right now in terms of length of average stay, ICU usage, And are people being kept in hospitals longer who would ordinarily be sent to rehab and assisted living centers sooner?
So last time we assessed the length of stay, it was around 11 days. You have to appreciate there's substantial variability based upon the individual, whether they're older or younger, if they have existing medical conditions or not. And the same is true for ICU and ventilator stays. We are watching this, and we are hopeful that as new treatments come out, the remdesivir is one. The other that's being used quite often here in the MSA is the convalescent plasma. That plasma taken from those who recovered are being administered to those who are hospitalized. And now that's being used sooner in the clinical course. And studies that have come out so far have seen positive results. So our hope is that that hospital length of stay will diminish, which should put us in a better position when it comes to the need for hospital beds in the future.
This question's from Telemundo, and it's regarding sort of the situation in the Latino community. Latino leaders in the area say the city has yet to fully engage with the Hispanic community when it comes to awareness and testing. They suggest using nonprofit organizations that work directly with the community, possibly having an all Spanish language forum with healthcare professionals and reps. How does the city, county, region plan to better engage with the community moving forward, knowing there is a possible surge expected in the coming weeks, and this community is having a high rate of infection?
I think that all the ideas and suggestions in that question are good ones. We recognize that we have an especially critical health challenge in the Latinx, Hispanic communities. We are increasing the number of opportunities for Spanish speakers to be able to access information, evidence the folks who are speaking on the press conference today and the press release that went out to the media. But there are a lot of nonprofit organizations that are already engaged in this effort, reaching large parts of the Latinx community. Community care and central health have been spending great resources directed to this because it's really important that it happen. But we can and need to do better. There's a mailer that is about a 40,000 person run that should be going out here shortly. Pamphlets to be handed out at construction sites. You saw the city council taking action that was focused on this particular susceptible population at our last city council meeting. Also talking about moving to additional Spanish-speaking forum for people in the community to be able to speak directly to those that are making the decisions, and to be able to share their ideas and their suggestions and their concerns, and to offer help. So it's a voice that we're hearing and are continuing to double and quadruple the efforts to make sure that we have trusted voices reaching out to all parts of the community.
Real quick, Dr. Zamora, is there anything you'd like to add in Spanish in response to that question?
Sure. Las clínicas de community care están ahí para ayudar a todos. Pueden ir a la calle 40 en el Hancock Center y ahí están haciendo pruebas gratis. Si no tiene aseguranza o tiene aseguranza, se lo pueden hacer ahí en community care en la calle 40 en Hancock. So, tenemos varias clínicas que pueden hacerlo también, pero esa es la más grande que tenemos. So, vayan, si tienen cualquier enfermedad, si están mortificados, les van a hacer unas preguntas y si califican, se lo hacen ahí gratis.
All right, back to you, Samuel.
Okay, the next question is from Univision. This one specifically for Sarah Eckhardt. In the past couple of days, we saw over the weekend, there were sort of incidents. We've seen video of rodeo and concert. Plaza R3 this past Saturday took place at full capacity. No one had face masks. How can we ensure future similar events won't happen in the future? What are some of the penalties for those establishments? A number of people have asked that sort of question today.
Absolutely, and thank you so much. Those were very troubling videos and photographs that were sent over the weekend directly to my cell phone, as well as to the Travis County Fire Marshal. The fire marshal went out to investigate. We have photographs and we have videotape from it, and we have reached out to the promoters and those who were responsible for that event and for others. We will be vigorously enforcing with regard to our mass gathering permits. There are laws on the books with regard to mass gatherings without permit. Unfortunately, much that was in our orders with regard to COVID-19, the governor has stripped away our enforcement mechanisms. But there are other things on the books that make it possible for us to hold people accountable for putting folks at risk. So we will absolutely be reaching out to those folks. Our primary objective here, though, is not to punish. Our primary objective here is to inform people so that they can make reasonable choices about their own risks, the risks of their household, and also the risks to the entire community. So as we reach out to these folks, it's really less about punishment and more about informing them of the very serious and present risk of such gatherings. But of course, we will enforce our mass gathering permits and make that people are held accountable for putting people at risk that way.
And the next question is from KXAN. If we move into stage 4 on that chart we saw earlier, and the workplace is open, it says expanded essential businesses and not reopen businesses. Forgive me for that. Can city officials tell the businesses that are currently reopened to close again when the state orders say they can be open? How would all of this work?
You know, I think that we're all focused on trying to reopen businesses. But if we overshoot, or if people are not taking the precautions that are set out by the state and by the county and by the city, if we're facing our hospitals being overrun and overwhelmed, and people dying needlessly because they're not getting the care that they need, then we're going to act. I would expect us to act at all levels, at the state level, at the county level, and at the city level, because no one wants people to unnecessarily die in hospitals. Ultimately, going back to what the judge said, these are decisions that we get to make individually. So I would expect at that same time that if our community is seeing that we're on a path to overwhelm our hospitals, I would expect our community not to go shopping at stores that are open, or not going to restaurants, or not going to bars, or not participating in conduct that's putting lives at risk. When we get to that place, and we'll watch it every day, if we get to that place, hopefully we can avoid it. But we'll all see over time whether we're getting close to 20 or not. That's a number that all of us, individually, at the city, at the county, at the state, all of us need to be watching those numbers.
This next question is from CBS Austin. How long would we have to be in a new zone before a switch is made? For example, if, let's per se, the hospitalizations dip below 19, how would, if we were to move up to the next stage, how long would it have to stay in that range to trip a switch to a lower stage?
And we can have Dr. Escott speak to this, but I don't think it's an exact science that way. I think that it's going to be the health professionals that are coming to us and taking a look at, how rapidly areas, how rapidly we're coming down. But the modelers tell us where the point is that we need to act. That's the key indicator, as the doctor said. He's taking a look at other factors as well. That's certainly a good one for the entire community to be focused on, because it's going to be, well, it's the key indicator and it's the most telling. Dr. Escott, do you want to address that question?
Thank you, Mayor. And what you said is exactly correct. Again, we have the new admissions to the hospital as the key indicator, that 7-day moving average, but there are supporting indicators. So for instance, if we dip over 20, and a week before that, we saw a sudden and marked increase in cases, that would certainly give us the indication that more hospitalizations are likely to be coming. If the new cases have been relatively plateaued and we see it dip into that 20 zone, it may give us a different indicator. So again, we are taking a number of things into consideration, the primary one being that new admissions by day, but not the only one.
This next question is from Co-op Radio. Given what the dashboard shows right now, what are the city and sort of the counties surrounding Travis County doing to sort of protect residents and commuters as the governor's task force reopens state business and offices? I guess sort of speaking to how are we working with the neighboring counties to handle this situation?
Should I speak to that? I think I'm on mute.
I can hear you.
Okay, good. Just checking. Our surrounding counties are in great partnership. We are in regular communication with all of our surrounding counties. Bastrop County's infection rate has had a little bit of a spike. I have checked in with the judge over there as well as our public health folks. And we believe that probably is because of increased testing in the nursing home community. So we are monitoring those circumstances closely in Williamson County as well as Hayes County. Again, our public health apparatus is serving the region, the Austin Round Rock MSA, and we're proud to do that. 2/3 of the counties in the state of Texas have no public health department, and we are happy and honored to be in partnership with our surrounding counties that don't have public health departments, so that we can make sure that there's equity across the region. But we really struggle with that without having a state backstop. We are in partnership with the state as well, but we are struggling with resources adequate to stretch across the entire region. But we will stay in partnership and we will get it done. We will stay at the table together in order to assure a level of public health available to everyone in the region.
Related to that, this question to Austin Chronicle, how is the city and county working with the state and neighboring counties to ensure consistency and reduce a conflict should we need to sort of change the stages that we've been speaking of?
Actually, we are in constant communication through our Emergency Operations Center with the Texas Department of Emergency Management, with the Department of Public Safety, as well as with the Department of Health. So Dr. Escott, you might want to speak to our partnership. Dr. Escott himself is the medical director. Are you interim medical director or contracted medical director for DPS as well?
Yes, I also serve as the medical director for the Division of Emergency Management and DPS through an agreement between the state and the city. And it's important. These relationships are important. And we certainly have been in constant communication with those entities, with other entities in the region and around the state. This is a national emergency, and it's important that we break down those jurisdictional barriers. A part of that was to implement a contact tracing platform here, which would help to span the barriers. That Salesforce platform that we are transitioning to is the same one that we recommended to the state that the state has now moved to, and that helps the contact tracing pieces. Something that folks might not understand, if somebody's tested in Travis County, but they live in Williamson County, that's a Williamson County case, even if they were exposed at a Travis County work site. And so having these barriers create challenges in managing epidemics like this. So this statewide system that we've been actively engaged with will help us to break down those barriers, help us to appreciate this as a disease which doesn't know boundaries, and hopefully will lead us to better control of it.
This question is from patch.com. In light of a NPR investigation that showed many testing sites are in white neighborhoods, are there plans to better accommodate testing sites to serve a more diverse population, and related to that, sort of encourage people to get tested knowing that our capacity has increased?
So I'll start with this one, and Sarah and Mayor Eckhardt may want to jump in as well. So we're working with our GIS analyst team to ensure that all of the sites doing testing are located on that map. We have Austin Public Health sites. We have one main one, which is a free drive-through site, and all of our testing is free. We have one for first responders dedicated for our fire and EMS and police officers and critical infrastructure team. That's a site. But Community Care, our partners in community care have a number of sites that they are operating. They're operating mobile sites as well. We have Baylor Scott and White, Ascension Seton, the St. David system, which is also doing testing. Austin Regional Clinic also doing testing. We know that CVS has started doing testing in the Austin region, and we expect those numbers to grow and grow and grow. So we are working on making sure that map is an accurate representation of where the testing sites are. Regardless of where the testing sites are, testing is available. If folks go on to that austintexas.gov/COVID-19 site, it's a free assessment, it's a free test, it's easy, it's quick, they are notified as soon as there's a result. And we encourage the whole community to go to that site and register and see if they need to get tested. It's not just for people with symptoms. We absolutely want people with symptoms to get tested, but there are also asymptomatic people who may be at higher risk for disease or complications. If they have an exposure, if they have underlying health conditions, if they have other factors which put them at higher risk, then it may suggest testing them even if they don't have symptoms. So we encourage everybody to go to that site and do an assessment.
I also wasn't sure on that NPR study. They said that they didn't consider testing sites that were not open all of the time. And I think that's because what they said was because you couldn't predict when the testing sites would be open. Very early in this process, we moved regular testing sites to the Eastern Crescent in our city. Not enough demand for us to keep each one of those locations open 5 days a week, but they are regularly open on the same day at the same time so that people in those areas know that they're open. And I was unclear in that article whether NPR counted those testing sites in the Eastern Crescent.
Dr. Zamora, oh, we just lost. Sorry, go ahead, continue.
I was down. I was unclear as to what the NPR article.
Yeah. Sorry, I was just. Sorry.
Oh, I'm sorry. We've also had a number of mobile testing sites in Travis County parks in the southeast quadrant of the county. So it is possible, and I haven't delved into exactly what the NPR story was counting, but it is probable, actually, that they were not including our mobile testing sites, for which we have Central Health and Community Care in partnership to thank. So thank you very much for our partnership in expanding free testing. We're also reaching out to the Chamber of Commerce to encourage employers to also pay for testing for their employees. We will not be able to do this alone, y'all. We will not be able to get to the level of testing saturation that this community really needs to manage this viral infection without having some private sector assistance as well.
The next question's from, oh, go ahead, I'm sorry.
Sorry, Mr. King, I'm going to interrupt you for a second. So, may I speak in Spanish to the Spanish public? Se puede llamar a este número de teléfono si quieren buscar a un lugar, si está cerca de su casa. El 512-978-8775. 978-8775 es el número del hotline de Community Care. Ellos los pueden dirigir a cuál lugar está más cerca a su casa. También tenemos lugares en Del Valley, Orange Bend, Del Springs, Colony Park y Pflugerville. También se puede visitar el internet de Central Health, que es centralhealth.net, para otras localizaciones. Gracias. Thank you, Mr. King.
Thank you, Doctor. This next question is from the statesman, and some of it's been addressed. I'll shorten it a little bit in terms of whether there are establishments who choose not to require a mask, or as the reports, the bar out in Elgin that would say they don't want you wearing masks inside. Is there any sort of message for those type of businesses in the region?
Well, you know, the city order makes it mandatory to social distance and to wear face coverings. Originally, that was enforceable both with putting somebody in jail as well as a fine. The governor has taken away specifically our ability to be able to enforce face coverings with either a fine or jail. So the only penalty we can now bring for failure to wear a face covering, the only real penalty is that more people are going to get sick and some of them will die. It's the penalty that we impose on one another and we impose on ourselves to keep everyone safe. Our order still allows us to have fines for failure to keep social distancing, and we had our code enforcement people out to the clubs. I'm hopeful that was just something that happened this first weekend when the clubs were trying to figure out and they got overwhelmed too. But it's important for everybody's safety in this community that we maintain that measure of social distancing as recommended by the governor and lieutenant governor. And we'll do what we can and what we need to in order to be able to enforce it. But as has been said several times earlier on this call, there are not enough sheriff deputies or police officers to enforce this. This has got to be something that we do to help protect one another, to help keep one another, and if not our grandparents, then somebody else's grandparents from needlessly passing away. And that's got to be the focus.
I'm going to jump in here on a second. So if there are businesses that do not allow the wearing of masks in their business, you shouldn't go there.
Absolutely.
That is completely irresponsible. And I'll tell you, if you're unhappy with it, the best way to manage that is to not go to that business.
And can I jump in also and tell everyone you know not to go to that business? Peer pressure is tremendous. And I want to give big kudos to the Texas Restaurant Association that put out best practices with regard to restaurants to look at ways to adapt so that they could open safely. Every restaurateur should want a level playing field. You don't want one restaurant right next to the other that's behaving badly while the restaurant next door is doing everything they can to keep their customers safe. It would not be a level playing field, and I fully expect, because I've already seen the restaurant community, the bar community, the festival community, the music community wanting to put in place adaptations that keep them safe, but also keep their patrons safe. So really, if someone's behaving badly, really sally forth and say, this is not appropriate. And I don't want to come to a restaurant or a bar that doesn't keep me and the people who are working here safe.
I'm going to combine a couple questions here just for timing in terms of the hospitalizations as a benchmark. So just to clarify this question from KView, hospitals are now the main benchmark for the color-coded guidelines. And how was 20, again, this from community impact, how was that determined as a threshold to stay under? And what changes could be expected if the county does move into the next stage?
So again, we use hospitalizations because that is less impacted by the percentage of testing. It's going to be a relatively fixed number, and it's a firm number across communities as a better indicator of when communities are facing stress as it relates to COVID-19. So what the modelers did, what Lauren Myers and her group did, is look at those cut points. At what point do we need to dial things down to avoid closure, and then primarily to avoid overwhelming the hospital system? So, in one version of the model, it was just, when do we need to stop things in order to prevent overwhelming? But then we asked her to go back and look at, when do we dial back so that we can avoid complete closure, but we still have enough time to place more restrictions, to decrease and flatten the curve again, so that we don't have to close. And that's how those cut points were decided.
Do you folks have the three exhibits that I had? The third exhibit that was in yellow, which is a chart from Dr. Myers.
There we go.
So this is a chart that demonstrates. No, you had it on the right one. That's it. That black line shows what happens in a surge if we're on the wrong path and if we go up above 20 hospitalizations. You can see that we could easily get to the place where we have 3 to 4 times as number of people than we have the hospital capacity to be able to handle. So what the modelers told us is, at what stage do we need to intervene, as Dr. Escott was describing, in order to be able to prevent that black line surge if we find ourselves on that path. So we're trying to do everything we can not to be on that path so that we don't have to cut off. But the cutoff, is established as the place we need to act if we're on the wrong path in order to present that surge.
This next question is from Fox 7. Many counties throughout Texas are listing the number of active cases. Why doesn't Travis County, and are there plans to release those numbers?
So we will be working on updating our dashboard. We are transitioning to two things. Number one, we're going to change the way that recovered are displayed and decided. Historically, we have been utilizing the method where we're calling folks back to confirm recovery. However, as the outbreak has grown, we're going to have to transition to what the state is using, and that's a calculated recovery. So basically, that's confirmed cases minus those who have died minus those who have recovered equals the active cases. And so we will be displaying that as soon as this weekend, but perhaps early next week.
I don't know if PIO is with us here, but I've gotten word that the city council meeting at 1:30 can't start because we're on the only channel that they need to broadcast on. So I don't know if we should cut this short or ask for one more question, but
Yeah, I think we have one last question and then we can wrap and we will skip.
Well, I think I kind of combined the community impact question. So in terms of if there's any move, and there's been a couple questions about parks and what the next phase is, if we could get some sort of clarity on that, when we can expect this, particularly with the county.
Sure. Our county capacity in the parks, as we saw over Memorial Day weekend, the parks were absolutely packed. Everybody wants to get outside and enjoy themselves. And I want them to be able to get outside and enjoy themselves, but only if we are, wearing the masks, practicing social distancing, and have adequate facilities available for people to practice good hygiene. So our Parks Department has been monitoring things closely to make sure that we are able to maintain social distancing, masking where appropriate, and also the personal hygiene capacity. So yes, we are having to limit folks coming into the parks, and in some instances shut them down when we believe we have overrun the capacity that's safe for those parks. We have a lot of parks in Travis County and in the city of Austin, as well as with some of our other municipalities. We work hard to have lots and lots of green space available for people. But we are in unusual times that require us to maintain social distancing, even when we're outside. It's definitely safer to be outside. I think that is has been at least suggested by the evidence that we are safer outside practicing social distancing, but we still have to practice social distancing. So we will keep enforcing social distancing in our parks, which may mean closing them down when they get to capacity, or when we don't have the resources necessary to assure people's safety.
Thank you. We're going to wrap this up since there's a work session happening. And thank you to Dr. Escott, Mayor Adler, Sarah Eckhardt, Dr. Zamora, and the full reporter for joining us today. Thank you, everyone.
And if anybody of any of the slides that have been presented, do they just reach out to PIO in case they want to run some of those slides in their company?
They sure can.
Great. Thank you very much, Dr. Escott. Dr. Zamora, thank you so much.
Thank you, Mayor.
Thanks.
Thank you.
If anybody wants to reach out to me and talk to me about Central